So if you're only missing one tooth, I want to ask you, why a dental implant over a traditional bridge that's proven?
Sure, great. So traditionally that's all we could do a bridge. So we cut these teeth back to little nubs, we make a prosthesis that there's an artificial tooth between them, and we glue them up, and it works pretty well for about 10 years typically, statistically. And then you start getting decay under it, or part of it fractures. So it has a limited lifespan, typically. But it's almost patchwork. So we do a bridge there. What happens when you crack the next tooth? And you're asking more of the teeth that are supporting the bridge. So now they function more. Now you crack that.
So you don't like bridges. You don't like traditional bridges.
I don't, when I can be very, very conservative, put an implant there to support it like a root used to do. We'll put the implant in a single tooth where it can floss around it, clean around it, maintain it. And it's not something that you're just kicking the can where it's getting worse over time. We're restoring you back to what you originally had. So for me, there's 40 million people in dentures. I don't want them to go there. The goal is to keep them from going to losing all their teeth. So the way that we do that is manage individual spaces or things that need to be addressed conservatively and appropriately, not like we used to do 20, 30, 50 years ago.
And then you think it prevents future tooth loss? Like if somebody even just missing one tooth, give them their tooth back with an implant, maybe it'll stop that snowball from happening?
It absolutely could. And so statistically, let's just look at statistics. A dental implant is 95% successful at 15 years, plus or minus depending on the study. 5 in 100 have failed at 15 years. There's nothing in dentistry close to that. So we want something that's predictable,
whereas
very
a bridge
easy to
is
do.
For sure going to wear out.
At some point, it's very likely a bridge is going to wear out because you're just asking, you're gluing this to a couple of nubs and hoping it holds up for however long it needs to. But how do I clean under that? Are you really going to be one of the 1 in 1,000 that have a little floss stutter that you floss under that? It's almost like a needle holder where you're flossing it underneath there and you're trying to clean out underneath it. You're really going to do that every day.
So for tooth replacement, somebody in your family missing one tooth, you're always going to go an implant?
100%. 100% all the time.
Okay, good for you.